Good morning and welcome to Hot Seat. With its lethality potential, fentanyl has been called the nuclear weapon of illegal drugs. My guest this week on Hot Seat is Dr. Don Kyle, PhD, who is the CEO for the National Center for Wellness and Recovery at the Oklahoma State University Center for Health Sciences in Tulsa. He's leading research into finding powerful but non-addictive painkillers. Here's a portion of that conversation. Good morning, Don. I'd like to ask you first about the National Center for Wellness and Recovery. You're the lead researcher there. Your history is well known. You've been a researcher on this topic, which affects millions and millions of people. But for people who may just be starting to tune in to this crisis, although it's been going on for many years, why is the center here in Oklahoma, and what does it do?
Well, yeah, thanks a lot, Scott. So the National Center here at Oklahoma State University, which we also call the NCWR, that's an acronym for National Center for Wellness and Recovery. It was conceptually founded, I believe, back in 2014 or maybe 2015, when a parent who had lost a child approached the president of the Center for Health Sciences at Oklahoma State University, Dr. Shrum, and suggested that doctors were not being properly trained in the area of addiction medicine and treatments for, substance use disorders and so forth. This really affected Dr. Shrum, and she then conceptually formed what is now the National Center and began changing the teaching curriculum for all of the medical school residents at the Center for Health Sciences, regardless of what discipline they were going into, whether it was gynecology or, internal medicine or what have you. They were all required to take courses in addiction medicine, which I believe was at the time probably one of the first universities to take those steps. So it began with training. And then there were some additional faculty members hired and things like that were doing research in the area. Then there was the official public launch of the National Center occurred in 2017. Some strange and interesting circumstances occurred in 2019 when the state of Oklahoma and Purdue Pharma, manufacturer of OxyContin, settled a lawsuit, and Purdue Pharma provided significant financial payment to the state of Oklahoma. That was in 2019, and at that time, the Attorney General of Oklahoma made the decision that 100% of those funds would be made available to support the National Center for Wellness and Recovery.
You're a world-renowned researcher, lots of awards, lots of citations, leading the National Center for Wellness and Recovery. But this gets into the world of politics. We see research ongoing, but by no means can anybody relax at this point. We still have an opioid problem. We still have people dead set to try to harm children at any age, frankly, from what we see about the fentanyl underground. Right now, what do you in your field need policymakers to be made aware of, and what do you need help on?
I believe this problem is so extensive and worsening in our country. All of those bases that I just mentioned have to be touched upon and supported and integrated together. Otherwise, I don't think it's going to be an easy fix.
We could go on, but my hat's off to you, Don Kyle, PhD, the Executive Director of Biomedical Research at the National Center for Wellness and Recovery. Good luck on all your work, sir.
Well, thank you so much, Scott. It's been a pleasure to sit here and talk with you about this topic. It's so important, and I'm grateful that you're taking the time to make this available to the folks, that are going to watch your program.
And that's Hot Seat for December 9, 2023. By the way, which is also the day of my bride's birthday. Happy birthday, Candace Mitchell. So thanks for watching Hot Seat. See the entire interview on news9.com and newson6.com. Follow me on my socials @Mitchell Talks.